Degenerative spondylolisthesis in the lumbar spine sounds scary. What it is where you have one or more of the spinal bones in the lumbar spine, it slides forward in relationship to the vertebrae below. What it does is it gives you symptoms and it drives you into the doctor's office with those symptoms. Symptoms like low back pain, tingling, numbness, weakness radiating down your legs, or it can affect the nerves that go into all the pelvic floor muscles and affect organs like the bladder, maybe a frequency of urination. Your medical doctor may say that degenerative spondylolisthesis is just a natural part of aging. Nothing can be done about it. Or let's just treat it symptomatically with the medications and maybe shots. But you're still feeling that uneasy, fragile feeling because your spine is weak. You can feel your spine's weakening. It's getting worse over time. You notice that you're not able to do certain activities that you used to before. You realize that your body is slowly becoming more and more disabled. Worried that you won't be able to pick up your grandkids or play with your grandkids later on. So in this video, I'm going to show you some non-surgical techniques that you can get rid of that pain fast, realign the spine, reduce that spondylolisthesis in that low back by aligning those areas. So take pressure off the nerve or allow those postural muscles to work better. Your spine will be stronger, you'll have more confidence, and you're just going to feel more optimistic about your life and your future. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. Before you do any of these exercises, make sure you check with your healthcare provider to make sure this is correct for you. If you want my free complete program on how to fix this spondylolisthesis, send an email at this address and put in the subject spondylolisthesis, and I'll send out that free program right away. So degenerative spondylolisthesis affects approximately 6 to 31% of the population in the United States. It's going to affect more females. As you get older, you're going to have more people have degenerative spondylolisthesis, which makes sense because it's an alignment issue. And if there's an alignment issue to those joints, the wear and tear over time without correcting the underlying cause of the problem, things will just get worse. So in this video, I'm going to give you some tools that you can actually address the underlying cause and get that spine realigned again. Take pressure off the nerves, allow those postural muscles to work better, along with that alignment process and allow your whole body to work better, and it's going to affect your total health. So people with spondylolisthesis, basically the cause is going to be where maybe there's an old trauma or they have a hyperlordotic curve where it's an increased curve, so it creates this force that goes forward and promotes the vertebrae to slip forward. So we're going to do flexion-based exercises, help strengthen, stabilize, and stiffen up around that spine, prevent any type of micro movements of that spine when you're out moving around, because the micro movements will irritate the nerves and create the pain again. Also, by doing these flexion-based exercises, it will help promote more of a flattening out of the spine, which will help begin the process of aligning the spine and reducing that spondylolisthesis. First exercise is going to be the abdominal curl up. And all we're going to do is brace the abdominals and perform a pelvic tilt where it'll flatten out that lumbar spine and perform 3 sets of 30 seconds. Then we're going to progress. We're going to get a wedge block. It's called an SOT block. Put a link in the description below. You get an SOT block. You angle it in this direction. You place it at the sacrum level, and then you perform your abdominal curl up. So it creates an increased wedge in the direction to start forcing that vertebrae back this way. So abdominal curl-ups would look like this. You want to brace the abdominals like someone's punching in the stomach, make a fist, curl up. And as you do that, it's going to cause more of a pelvic tilt and flattening out of that lumbar spine. So you want to curl up and hold this for 30 seconds. Repeat 3 repetitions. The progression of that would be is to get your SOT block, place it underneath that sacrum like we showed you on the model, perform that pelvic tilt, brace abdominals, curl up into this position, and hold it for 30 seconds. Repeat 3 repetitions. Next exercise is going to be a traction. We want to use that SOT block again. If you have access to an inclined bench or a table, or if you have a weight bench at home, lift it up a little bit on one side. Place that block underneath your sacrum. That will promote that flattening of the back. You place a pad over your pelvis and then use a weight to help drive a force down to promote the reduction of the spondylolisthesis. So the way it works is that you start off 30 seconds to a couple minutes at first, gradually increase the time until you get up to minimum 10 minutes, optimal 20 minutes per day. The length and time is important because what we're trying to do is create a viscoelastic creep formation or a spine and molding effect in the soft tissue of some of the things like the spinal disc and the longitudinal ligament. And you want to create permanent change this way. So once you're able to get to your maximal correction, which could take some people 3 months to a year to actually do this. But once you get to that maximal correction, studies show when they follow up that those corrections will stay a year later. Okay, this is what this would look like real time. So you get your SOT block, you set that underneath your sacrum. So you're going to feel that pelvic tilt starting to traction out. You place your pad on your pelvis, get a weight. This one happens to be about 20 pounds. Put it down by your pubic bone so you get a nice line of drive coming through the lower lumbar spine. And you just lay in this position and let it do its work. Optimal time is 20 minutes. Try to do it minimum 3 times a week and keep that up for 3 months. If you want my free complete program on how to fix this spondylolisthesis, then send an email at this address and put in the subject spondylolisthesis, and I'll send out that free program right away. We really appreciate serving you, and we'll look forward to seeing you on the next video.